Positive Pulse. Take care of your mind. On this episode, we talk about COVID-19 and its effects on mental health. Enjoy!
Okay. Hello again. We are back with our final episode of our podcast about mental health and finding our voices through all of this. Last week, we talked a lot about access and the issues surrounding that. But this week, I will be talking about the COVID-19 pandemic and its mental health impact. So just to start with one question, I wanted to know if anybody wanted to give their own experience about social distancing and how that affected your mental health or voice or anything like that back in 2020.
So for me, when all of that first started, I was working in a senior living center. So I was in a healthcare setting where I did have to do all the PPE and cleaning and all of that stuff. And it was really scary, I think, being in that environment and not really knowing what was happening and just kind of having to go with the flow with everything changing every day, what they were saying about it. So it was very, I think, scary and lonely. And I felt like I had my coworkers that understood, but I don't know, my family didn't really understand, and that was really the only people that I had access to talk to at the time because of social distancing.
I think it was a interesting, it was very weird to me. Definitely looking back and thinking about how, we stood out of stores 6 feet apart from each other and things like that, and you couldn't hug people. You saw the pictures of people outside windows just kind of separated from each other. I think that was really weird. I mean, my parents, they were essential workers, so they went to work, so it was just me and my sisters most of the day, so we just kind of hung out. But it's weird to think that people were separated like that, and how I definitely think it impacted a lot of people's mental health on now you can't see your grandparents because you're afraid to give them something.
That was really good. I love your point, Sarah, of being in the field itself. I can't even imagine what that is like. But I'm gonna read some stats from that. That is from, I think, just the CDC website. But over the course of the pandemic, many people reported symptoms consistent with anxiety and depression, with approximately 4 out of 10 adults reporting these symptoms back in early 2021. And then because of this, there was an increase in drug overdose, suicide rates, a ton of different negative mental health results because of this. And so my next question is if any of y'all have seen any type of long-term or are seeing maybe more long-term effects post-pandemic, just because I think that's something really interesting to think about.
Yeah, I think I've seen that definitely in myself, and then even in patients. During the pandemic, I didn't really notice a lot of changes because it was just it happened so quick, and I kind of just adapted to it quick, and I got so used to this is just life now. It wasn't until after that I noticed I remember when masks were lifted, I was kind of freaked out to stop wearing a mask. And I was it was weird because I went from you wouldn't think twice about going to a grocery store. So I was suddenly calculating every decision of oh, well, some people aren't wearing them, or I was getting on a plane and I was do I still wear one? Do I not wear one? So I think I've seen the long-term effects of, especially in the first year when things kind of loosened up, just the anxiety about germs and spreading things and what's the right thing to do, because it's just I was I changed a lot of what I did. And then in patients, I think it's interesting because we are in a post-pandemic, but we still technically get cases of COVID in the hospital. A lot of them are much more mild, but I've had patients that are still freaked out to come into the hospital, and it's definitely changed the healthcare scene a lot. I think society, we've kind of went back to normal, but even in healthcare, it's wild to learn about it and we have different precautions. And I think people are just generally more cautious now since it is still prevalent and we still get cases of it and we still see people getting it and it spreading. So that's been interesting to see that, it's still around even 4 years later.
No, I can't even imagine what it's like in the healthcare field. I just feel like some things post-COVID are just how it is now. So I always enjoy y'all's perspective on that. But I have some more stats of long-term effects of COVID. But not only has isolation affected mental health, but those who have had COVID are at a higher risk of mental health issues and just health issues in general. And this is also from the National Institute of Health. If you get COVID-19, you may experience a number of symptoms related to brain and mental health, including cognitive and attention deficit, brain fog, anxiety and depression, psychosis, seizures, suicidal behavior. Data suggests that people are more likely to develop mental illnesses or disorders in the months following the infection, including symptoms of PTSD and many symptoms related to brain function and mental health. And so my last question is kind of on a different direction than that, but I wanted to talk about some positive or just not overly negative aspects of COVID that relates to finding your voice. And I remember during this time, there was a lot of talk on social media and things protesting and very relevant issues such as Black Lives Matter and things like that. And so I just wanted to know if any of y'all remember any instances of people using their voice during this time, or if you had any personal experience doing this. I don't know. I just think that's one positive thing that came from.
One thing that I saw as a whole, as COVID happened and then looking after COVID, kind of after pandemic, I feel we all as a society, we felt the negative stress of mental issues and just feeling so lonely and in that time, not really knowing what to do or what to expect in the near future or anything. And I think because of everyone feeling this negative kind of sense in their mental health, it caused a lot of talk around mental health, and it caused a lot of discussion about what should we do about mental health, what treatment plans should we do, and how can we help those who are affected by mental health. I think looking kind of now, we have, as a society, we've understood that mental health is a very, very prevalent issue in our society, especially post-COVID and during COVID. So definitely just the discussions around mental health in general and opening up conversations about treatment plans and how we can help those who are suffering.
No, you're good. I was just saying one thing that I learned too was the advocating for yourself as a caregiver. The burnout was really real, working all those long hours. And again, that isolation of I don't want to bring anything into these people I'm taking care of, so I'm not going to go in public at all. And I'm going to order my groceries online and not talk to anybody except for on the phone. And I think there was a point where I just had to stop, and learning how to speak for myself and saying it doesn't make me weak, it just makes me human. And not being bullied into doing things that I didn't have to do, working more hours that were unsafe. So I think I did learn how to use my voice, especially when communicating my boundaries with an employer.
Both of those are really good. I definitely relate to the mental health aspect of it and feeling way more comfortable post-COVID and just having that time to, I guess, reflect and get more comfortable figuring it out for myself and just being more open about talking about it. And that was all of my questions, but does anyone else have anything else to say about what they've learned from this, or your own personal mental health journey? Anything in relating to this? Okay, so that's all I have to say about COVID-19 and its effects on mental health. this is the end of our podcast, and we hope that everybody has learned something from our conversations and experiences. So thank you guys.